Welcome, everyone. Thank you so much for joining us today. So this is another installment of another Be Well talk that we are offering. And so if you've joined us before for these webinars, these are informational. This is an informational series about a variety of different topics related to the experience of cancer. And so our topic today is on the benefits of manual lymphatic drainage. So for our presenters today, we have with us Bethany Weir, and Bethany is a manual lymphatic drainage therapist and fascial stretch therapist with over 10 years of experience. She holds a diploma in massage therapy from the Canadian College of Massage and Hydrotherapy and is certified in manual lymphatic drainage from Dr. Botter's School International. She practices massage therapy through various techniques and movement therapy, and by integrating therapy with a rehabilitative approach, she provides individualized treatments tailored to each patient's needs. We also have with us today Rona Bimeda. So Rona is a highly experienced registered massage therapist with over 14 years in the field. She holds a diploma in massage therapy from Centennial College and has advanced training in manual lymphatic drainage from Dr. Botter's School International. Beyond her hands-on practice, she's also an educator at Centennial College and an assessment advisor for the College of Massage Therapists of Ontario. So I'm very excited to have both these speakers with us today, and so I will pass it over to Bethany for our presentation today.
Welcome, everybody. We are so excited to be here today to talk about the benefits of manual lymphatic drainage. My name is Bethany, and we will show you closer to the end of the presentation today that we also have Rona here doing the demo, and we have our lovely volunteer, Diana, who is receiving the lymphatic drainage treatment today to be able to show you some techniques later on through a demo. So I am a registered massage therapist, like they had mentioned, practicing manual lymphatic drainage as well as Rona. Combined, we do have over 20 years of experience, so we're very excited to be here today. With Diana being our volunteer, she has previously consented to the treatment today. Consent is a very important part of what we do, so I just wanted to mention that. And so thank you so much for having us. And today we are just discussing a few things about lymphatic drainage. Just an intro to the basics of the lymph system, how lymphatic drainage applies to our patients, a little bit of the history of lymphatic drainage, where it is today, including different therapists across the world, benefits, treatment expectations, and where to find qualified therapists. So we're going to start off just by discussing what the lymphatic system is briefly. So it's essentially the body's natural waste management system. Sometimes I am asked kind of what the difference is between that and maybe the GI tract. So this is a separate waste system. This basically filters what the body does not want in a different way than the GI tract. So it is separate to that. It is basically combined fluid, waste, debris in the body, and we collectively call that lymph fluid. So that's what we're referring to when we're talking about draining the lymphatic system today. We're talking about the lymph fluid and the debris and the extra waste that we don't want sitting in that. So basically, when we have an excess amount of this waste in a given area, we can have unwanted swelling, inflammation, and a buildup and a congestion in a certain area of the body. So this is where the manual lymphatic drainage really benefits someone's body when it builds up in a way where the body is not able to dispose of that on its own very easily. And so this is why people come in for this treatment type. So manual lymphatic drainage is a decongestive therapy, and it's able to decrease this buildup of congestion in any given area, such as the swelling and the inflammation. So a little bit of the history, we'll just call it MLD for manual lymphatic drainage to make it a little bit easier. It was founded by a doctor. His name was Dr. Botter, and he worked with his wife when working with patients to help decrease this buildup of lymph fluid in various areas of the body. It was around the early 1930s where he started practicing specific hand placements and massage techniques and to try and solidify how to drain the body more naturally. He noticed that there was an ongoing kind of problem with patients where they had swelling in different areas, inflammation, and he started wondering if there was a way that he could deal with this fluid in a safe and effective and a natural manner. So he took his time to research and discover that his thought process was correct through various hand placements and technique. He was able to drain the body naturally. If you read through his research and through the book that he wrote, he was very intuitive with his practice, and he kind of pictured what the body looked like and what he could do to better drain the body. So that's where he started with his research, and he found out that his research was correct with the hand placements and the different techniques that he used. So his research and his commitment in writing his book is about 40 years that him and his wife worked on. And so that is what is considered to be taught as the standard manual lymphatic drainage that we practice today, which is pretty amazing. And so just with that in mind, we do want to talk about the benefits of lymphatic drainage through cancer specifically. So I know that is the audience of who I'm talking with today. So the benefits of the MLD through cancer treatment is that it is an opportunity for this gentle movement of lymph fluid to be disposed of in a safe and an effective manner. It helps to take away that heavy feeling, that heavy buildup that patients can have with that cooling of the lymph fluid. And so when we're dealing with this type of condition, we actually reroute the fluid when it is built up in a specific area. So for instance, if you have a left side that is affected and there is some buildup going on there, we actually can reroute the fluid so it drains into the right side. That is how we are able to decrease the fluid buildup in a specific area. And so in a situation where it continues to pool, that's when you have permanent swelling, and that's when you have a condition called lymphedema. So manual lymphatic drainage with lymphedema, there's a few things to consider before you know if you have this condition or not. First off, it is very important that this is a diagnosed condition by your doctor before seeking treatment. This is to ensure that the treatment that is being done is done properly and correctly in terms of the sessions, the amount that the patient may need. Bandaging can be required for treatment. If it's true lymphedema, those are some things that we look at in terms of the treatment approach. We need to reroute that fluid, and we need to use bandaging to decrease the buildup in that given area. One of the things that people sometimes ask is even the difference between primary lymphedema and secondary lymphedema. And this is one of the things that's really important to discuss with your doctor because the primary lymphedema, we actually don't necessarily know the cause. It could be from birth, something that we might not exactly know why it's happening. So when we're working with cancer patients, we know that it's secondary lymphedema if surgery has been involved, for instance, because we know that something has interrupted the lymphatic system. If we have less lymph nodes, then we know that's the reason that it's not draining. So we know that we need to reroute the fluid at that point. So it's really, really important to discuss that with your doctor so they can guide you as necessary, as needed, to which treatment would work well for you. So when lymph nodes are removed, for instance, that causes the body to not be able to drain as effectively or as easily because there's nowhere for that lymph fluid to go. And lymph fluid will drain through the lymph nodes. So that's why we need to reroute the fluid. So if they're removed from the front of the shoulder, like I had mentioned, and it pulls into the arm, then we can stimulate an area and then help to drain it. And so it's really important for the practitioner to know where to work. And something else to consider when you're thinking about manual lymphatic drainage is who can practice it? How do you know it's safe? How do you know it's an effective treatment approach? So healthcare providers are the only individuals who are actually able to do the training through VODR. As I had mentioned earlier, you need that eligibility through them. Most commonly, you will see RMTs, the registered massage therapists, practicing the manual lymphatic drainage. But sometimes you will see nurses, physiotherapists, different healthcare providers. But just know that that is the direction that you want to look in when you're considering manual lymphatic drainage. Just because the VODR just ensures that they have good standing with their college. They check that eligibility to ensure that you're getting a safe and effective treatment. Where and how you can find a manual lymphatic therapist is actually directly on the VODR website. So if you go to voderschool.com and you click on the Find a Therapist link, it will give you every single VODR therapist in the entire world. And so you can find someone that is close to your location, someone that you're comfortable with. Everybody on that website is up to date in their certification, which is very, very important. And when you're looking for a cancer lymphedema therapist, they do require that level 3 therapist, and you can find that information on the website and it'll let you know. So it's not just about finding a VODR therapist, but you do need to find the appropriate level, and it is listed there on the website, the level 3 therapist. And so, as I had mentioned, VODR is the gold standard, and these are some of the reasons why VODR is considered the gold standard, because they are rigorous in who is able to do this type of training. And they're very diligent in who they put on their website and making sure that everyone is up to date and everyone is on the same page. And whoever you see, the treatment approach really should look the same. So let's get into what a lymphatic treatment would look like if you're going in to see a manual lymphatic therapist. So it is all research-based. So you want to look for the Dr. VODR manual lymphatic drainage book. So those are the treatments that we will be tailoring everything to, is what we learned through that book. And so for VODR therapists, we will always start on the neck, for instance. We'll stimulate that area first, just because that is where all the lymph fluid actually drains through, is the neck. And we have to stimulate before we drain, or the fluid just will not be pushed naturally and properly through the body. So it's crucial that you start on the neck, just because that's where it drains. And so the technique itself is done through a few really crucial ways. First of all, the massage techniques really need to be gentle. This is very, very important. It should not feel rough, and it should not feel like a lot of aggressive pushing. Although we do deeper techniques sometimes, they are not rough, and we do not forcefully push the fluid. We actually work with the body and allow it to be pushed naturally, as to not damage any of the lymph nodes. And so we're actually rebuilding some of those lymphatic pathways. We're able to get it flowing much easier. And it's actually a more lasting effect because you're speeding up the entirety of your lymphatic system. You're not just forcing the fluid through the body. So it's very, very important that the techniques are gentle. And if they are deeper, it's something, they are still techniques that are working naturally with the body, and it's not actually being forced. And so if our hand placement's not proper, then your fluid doesn't drain appropriately, and our direction is very, very vital. So those are a few of the things that you can look for also when looking for a water therapist. And just talking even a little bit about the initial intake. If you're coming in and you have, your doctor has approved that that this is something that would really benefit you. And even if you don't have lymphedema, just the preventative care of lymphatic drainage can help your arm to not feel heavy, for instance, and it can keep it from pooling, just because it does speed up your entire lymph system. Doesn't just get rid of the fluid that's already there, but it actually helps your body to drain overall. So your initial intake should really be looking at what bandaging would look like. That's very crucial if you do have a lot of swelling. Exercises, self-care, including skin routine, treatment plan. These are some of the things that you would expect coming in when you're looking for a lymphatic treatment, just so we can be pushing the fluid and being as diligent and as effective as we can be. It's important that you know how to take care of yourself and what to expect out of your sessions, as these sessions should be about you. And so it's also important that your therapist gives you an opportunity to ask questions. I know that it can be a lot of information, it can be overwhelming, but it's really, really important that you feel really comfortable, and that you're able to ask and understand as much as you need to, prior to committing to a treatment plan. And so I am very excited to have Rona now show us a little bit of the demo of what that might look like. So we can show our lovely Rona working on our lovely volunteer Diana. So I'm just going to talk through a little bit of what we discussed, so we can kind of put a little bit of visual to that. So as you can see, Rona's doing a lovely job stimulating the neck. This is super, super important. It's nice and slow. It's very rhythmic. It's very comfortable. I know some people are nervous. They think about massage being like deep pressure, but in this case, it's very rhythmic. It's very, very light. This is just an example of what we would be going through. We actually do spend a little more time on the neck in a true session, but just for the sake of you what this might look like, it's very relaxing. It works very directly with your nervous system. And so it's very, very light. She's going through, and it feels very, very nice. It makes me fall asleep if I get one of these treatments done. And when you see her hands moving along her collarbone there, that's actually where the fluid exits. So it's very, very important to do that, and it's really a great technique. And here you can see how she is pushing the fluid across the chest. This is actually how we reroute the fluid. So in this case, we would assume that Diana's left side is actually the affected side, and we are rerouting the fluid by pushing it into her nice, healthy lymph nodes over on the right side there. Yes, and we always stimulate before we drain. So she stimulated the neck, she stimulated the chest, and now we're pushing this fluid up the arm. Anything extra that might have pooled over, and she puts it right into the exit point there in the neck, which is great. It's nice and slow, super rhythmic. It's not painful at all. This for me. And you can see here, this is one of the deeper, more specific techniques. It's still quite gentle, as you can see, but we're just able to push the fluid at a higher, more effective level with this technique. And so it is a bit deeper, but it feels really nice and it takes away that heaviness, which is fantastic. And that will come right up the arm and drain right up into the neck. We do down the arm and then we come back up the arm to make sure we get as much fluid as possible. So that's fantastic. Really nice technique, Rona. Looks very good. Very nice. Yeah, so that's just an example of what a lymphatic session would look like. And so yeah, and just like wrapping it up, we just really appreciate you guys listening to us today. We're very, very happy to have the attention of you all. So thank you so much for having us. We would be really thrilled if anyone had any questions for us, and I'd be happy to answer them to the best of my ability. So we'll take some questions.